Facebook, Fila FM 89.3, and on TikTok, Akosia Fila. So you can join us on any of the platforms and watch us live. And as you join, remember to also share for others to join and also benefit from our discussion. So joining me to talk about this topic, I have Barnabas Atangongo right here with me, and he will be digesting it for our understanding, because the topic already says understanding attention deficit hyperactivity disorder. So he will help us understand this particular disorder. My name is Akusia Kwatma Boachi. Now let me welcome Barnabas to the studio. Barnabas, good morning.
Good morning, AKB.
Hey, as a last week now you're a Lone Ranger.
Last week now me a Lone Ranger.
And this week so Lone Ranger.
And also I am a Lone Ranger.
Are o ma jabo so ana.
Omunja it's just that there are some equally important things that have come up.
Yes, I understand. I understand.
We have to let them go and take care of it.
Yeah, I understand. Pa say wo ya obe hold it down the fort here.
Sure.
They are free to also do other equally important things,
yeah,
as you just mentioned. So thanks so much, our listeners. Thanks so much, our viewers, for staying tuned in. It's now time to come your way with our mental health this morning. And as I have introduced my guest to you already, Barnabas is seated. Barnabas, so understanding attention deficit hyperactivity disorder. So what is this attention deficit hyperactivity disorder? What is it?
Okay, so good morning to our cherished listeners. Just as AKB said, we are going to make sure that we help you understand attention deficit hyperactivity disorder. That is equally what I'm going to do this morning. And with attention deficit disorder, as normally we come here, most of the things that we are going to talk about are related to issues that are bordering on our mental health, or issues that are causing some mental health issues or some mental health deficit or difficulties. So with attention deficit hyperactivity disorder, one thing that we must know is that previously it was having a different name, where people were calling it attention deficit disorder, that is ADD, and currently it has been modified to attention deficit hyperactivity disorder. So currently that is the current one. So others still call it ADD, but that is an old term that now has been modified. When we talk about attention deficit hyperactivity disorder, it is nothing too extreme, but it's a mental condition. Okay. That's the first thing that I want our listeners to understand.
Okay.
It's a mental condition that individuals experience. And with this mental condition, it is not only restricted to, for instance, children, but most of the time we diagnose it when people are within their childhood period. So a lot of the time a lot of people tend to think that it is a condition for children. No. It is also a condition that is being diagnosed within adults. So, for instance, within children, it has been identified that about the prevalence is about 8.4%. So that means that if I'm to run it up, maybe because for human beings we don't have 0.4 of a human being, so let me just run it up to 9%. So if I'm to run it up to 9%, what it means is that if you pick 100 children, we are going to have 9 of them having attention deficit hyperactivity disorder, and this is a feature of a very common condition that is being diagnosed within childhood. And within adults, the prevalence ranges from, I think the prevalence is within 2.5%. It is actually at 2.5%. What it tells you is that sometimes, for instance, some people go undiagnosed during their childhood. So in the adulthood, they don't go back for diagnosis. So we are obviously seeing the prevalence in adulthood being less. But the key thing is that with attention deficit hyperactivity disorder, this is a condition that can be found in both children, that is within the childhood period, and also can be found within the adulthood. And coming back to it, when we talk about it, what does it mean? What it means is that it is a mental health condition that is characterized by persistent. So the key word here is persistent. Persistent inattention. So inattention means that there is a particular task for the child or the person to focus on. They find it difficult really focusing on that particular task. Example, this is a child that is in school. The teacher is complaining that this child cannot sit still. When you tell the child to sit here, by the time you realize the child has moved to a different place. When you tell them this, they've moved to a different place. They are not able to concentrate to do their exercise in school. They are not able to write. They are not able to do their homework. When they come, even if you are lucky, sometimes you are not lucky, they will even misplace their books. You buy new books for them, they will misplace it and will not know wherever that it is. That is a sign of inattention. So the inattention should be persistent. Then another key thing is that there should be persistent hyperactivity. So when we talk about hyperactivity, normally in our local dialect, sometimes people call them like stubborn children. So those kind of individuals, you realize that when you place the child at one particular place, the child will jump on the table, move under the table, hold something, trying to tear something down. When you tell this child is not able to really sit at one particular place, the child is all over the place, and this hyperactivity must be persistent. So normally we compare the child to other children of their age, and you yourself, you realize that the way your child possibly is all over the place signifies some significant impairment or some significant change in your child. So there should be the persistent hyperactivity as well, and also there should also be impulsivity, and this impulsivity and the hyperactivity and the attention should interfere with their daily life functioning. And for mental health, we normally focus on daily life functioning, because if you are doing all these things and you're able to go about your normal duties, then it is not going to be a problem for you. But if you're experiencing the inattention, you are experiencing the hyperactivity and the impulsivity, they have to also impair your daily function. So talking about daily function, if it's a child, this child is not able to perform well in school, they are not even able to stay even in school. If you send the child to your workplace, you cannot concentrate on your work because the child will be all over the place. You have to make sure you are taking care of that particular child in that instance. If you are an adult too, it means that it should affect your daily activities, which can include work, it can include your relationship, it can include, if you're also in school, it can include your school, and every aspect of your life. It can also affect your social life as well. So the key thing for us to note here is that when we talk about attention deficit hyperactivity disorder, it is a mental condition, and with this mental condition, it affects both adults and children. Just that we normally diagnose it early within the childhood period, and a lot of children have been diagnosed of this. And with this, you should have persistent inattention, persistent inactivity, and it should also come with impulsivity. Impulsivity means that by the time people don't really think through the things that they do, they just do it when they just feel like doing it. So this is what we mean by attention deficit hyperactivity disorder. So some people just call it ADHD, as AKB mentioned earlier on. So now if you hear ADHD, it is nothing different or it's nothing scary. It is just attention deficit hyperactivity disorder. Some people don't want to pronounce this long word, so we just coin it. Yes. I am now say wakakra. So we just coin it in that way. So okay, that is it.
Okay, so thanks so much for the intro. It affects children and also adults, but mostly children, because
yeah, and we diagnose it earlier within the childhood period.
Okay. Okay, all right. Because it will show you the parent cry. No, we never catch us seek help, because it will worry you a bit. All right. So now let's look at the common signs and symptoms across children, adolescents, and also adults as well.
Okay. So with attention deficit hyperactivity disorder, because of the way it has a way of presenting or showing within different groups of people. Of course, when it's children, children, their reasoning is different from maybe adolescent and also adults. So, for instance, a child, if it's a child, one key thing that you should normally be focusing on is that the child cannot stay still. And with this child, they have difficulty if it is in school, they have difficulty actually staying in school. If you buy them books, pencil, they are not able to take good note of it. So if they are also in school, one area that can also help you is their teachers. You are likely to hear complaints from the teacher that your child is not able to sit still. When you give them homework, they are moving about. Whatever that you tell them, they don't listen, and those kind of things. Sometimes those children, if the teacher is not much knowledgeable about some of these things, the teacher may end up caning them a lot. And you realize that the more you cane, this person is not changing. So it should also tell you that it is something that is not because of just a behavioral thing that the person is doing, but it's because of a condition that the child might be experiencing or might be behaving in this particular way. With teenagers, we are going to also see poor time management in them. When the person is a teenager, you are also going to see some emotional reaction. Remember, we mentioned that it also comes with impulsivity. So any little thing, you are seeing some anger tantrum being thrown. You are also experiencing some depression out of the blue. You are experiencing some anxiety out of the blue. And also, a key thing that we see in teenagers is that they also engage in a lot of risky behaviors. So, for instance, the child knows, by the time you realize this child is trying, maybe taking substances, this child has said people dating other people, this child is jumping into it. Anything that seems risky, this child wants to try. They don't really care about the consequences. What they are interested in is to just try these risky behaviors. So for teenagers, we can look out for relationship. Everyone needs some form of attention, even though the men tend to normally say that the women want attention more than the men. But the truth is that we all need attention at one point in time, and this is a condition that comes with inattention. So if you are in a relationship with such a person, you are obviously going to feel ignored. The person will have difficulty sustaining that attention for you. The person might want to do certain things to impress you, but because of the difficulty, because of the condition, this individual is going to have difficulty performing or sustaining that attention to impress you in that regard. So for instance, you can look at a JHS student that want to study. Typically, if the person is having attention deficit hyperactivity disorder, by the time this person realizes, the person has opened a book all right and the book is in front of them. By the time they realize, they are looking through the window, they'll press their phone small, they'll make some noise more, go and sit somewhere and come back, walk. By the time you realize, 2 hours is already gone, and they spend the 2 hours without actually knowing whatever that they did with the 2 hours. And the time you realize that the time that they were able to use to focus to study was just a little that they were able to use to focus to study. So we should know that with attention deficit hyperactivity disorder, as we said, it occurs in all age groups, but with children, we should focus much on their difficulty to sit still. So if you realize that your child have difficulty sitting still and it's all over the place, that is a key or a cardinal symptom for you to follow up on it and to seek help. With teenagers, we should also look out for risky behaviors, sometimes to time management. If the person is an adult and you realize that you are always having difficulties at your job place, you have difficulties following your tasks, you have difficulty observing your tasks or going through your normal job routine, it is also a key thing for you. You have difficulty with your relationship as an adult. If you get a new girlfriend or if you get a new person, by the time you realize something just flimsy happens and the person goes, this is also a key or a cardinal thing for you to look out for and try to seek help. So in general, we should also know that with attention deficit disorder, it comes with that inattention, the hyperactivity, and the impulsivity that I earlier on mentioned again.
Okay, so quickly let's look at the causes of ADHD, and definitely there might be some misconceptions around it. And then let's look at those misconceptions as well.
So let me start with the misconceptions.
Okay.
So with ADHD, a lot of people have some misconceptions around it, and the way the condition also presents. If the person is a child, you might think that the child is spoiled when you look at it at first glance, and maybe the mother is tired of always correcting the person, and the mother just ignores the person. So if you are a new person and you are introduced into that situation, you might think that, oh, this mother has allowed the child to be spoiled or something. So sometimes people think that it is because of a spoiled child, that's why the person is behaving that way. But no, it isn't because of that. And when we talk about the causes, we will know the reason why. Others also think it's a form of spiritual punishment.
Okay.
God doesn't want to punish you in that way. God has already told us that if you don't do the right thing, He's going to send us to hell. So He's waiting for us to send those who don't do the right things there. So those who are always practicing a lot of cobra work, they can stop. So God doesn't want to use your child, or doesn't want to use this disorder to punish you. God loves all of us. So it's not, ADHD is not a form of a spiritual punishment. Then there is also normally a lot of people talk about if a child eats too much sugar, it causes ADHD. The truth is that there are some evidence that if a child eats a lot of glucose containing substances, sometimes they become a little hyper. But this is a disorder, so this is not something that is caused by
a one-off kind of thing.
Yes, one-off thing that the person ate some cake and some ice cream and other things, and the person will become hyper throughout their life. No, so that is not something that is caused by eating too much sugar. And also looking at the way it presents, especially if it is in children, some people think that it's for a form of bad parenting. That is not a form of a bad parenting. Even bad parents, to a certain level, they are able to tell their children to sit at a particular place, and sometimes the children listen to them. But with this, you are going to have difficulty. Even if you are the bishop of God and you descended from heaven straight, you are going to have difficulty because of the condition or because of the way the disorder presents itself. So we should know that these misconceptions that people normally say about ADHD are not really true. Now, coming to why people normally experience ADHD, or what brings ADHD, what are some of the risk factors, some of the things that predisposes people to developing ADHD. With ADHD, one thing that we should know is that it has a genetic cause, or it has a genetic connotation. So when I talk about genetic connotation, what it means is that it could mean that there was someone in your family that also experienced ADHD in their lifetime. Sometimes the way genetics present is very different. Sometimes it's very hidden. It's very hidden. You don't see it very plainly, because sometimes it can happen to your great grandparent, and it will jump. Maybe unfortunately, you experience it in your child. So sometimes when you ask people, will say, "Oh, no one in my family has it," but if you were to really do a proper scrutiny, you realize that someone ever experienced it in your life, just that possibly you are not aware of it. Yes, so one thing that we should know is that it has a genetic connotation, and that is one of the reasons why these days, even with marriages, we advise that people do go and do this kind of genetic test to see how compatible that they are. If there are some in your family, it is not a reason why you should refuse to marry someone, but it will give you a sense of what to expect. Okay. So you put measures in place to help a child that comes out of that, because there are proven ways that we can use to help children with that. Another cause or form of a risk factor of ADHD is the way our brain functions, and brain abnormalities and other things. So for instance, there are certain neurotransmitters in our brain that makes us very excited, that makes us to move all over the places. So sometimes if there are imbalances in them, or there are some difficulties in some brain structures and the way our brain produces these substances, or the way our brain helps the neurotransmitters to function, sometimes it can also be a predisposing factor for people to develop ADHD. Yeah. So for instance, there is a part of our brain that helps with the regulation of attention. So with that, if you're having an issue at that part of your brain, we are definitely going to have difficulties concentrating. So that is our frontal lobe. So the part of our brain that is just on our the front of our face. Your mama so. So at that point, forehead. It can be a camera for no. So
the no why only about me you out.
No. So your forehead, so your frontal lobe is just within our forehead. So if there is an abnormality or there is some impairment within the frontal lobe, it can affect your attention. So some children with attention deficit hyperactivity disorder, it has been identified that they have some abnormalities within that frontal part of their brain. That is why they are behaving this way. So we should know that the brain functioning and the structure of the brain and issues that relates to the brain can also predispose someone of developing attention deficit hyperactivity disorder. And the last thing that I will add is that sometimes there are environmental factors that people actually relate ADHD to. Okay. So with environmental factors, it has been linked to, for instance, premature birth, low birth weight, or parental exposure to alcohol or tobacco, especially during pregnancy. And this is something that these days the women are doing, where you don't normally see a lot of women drinking alcohol or smoking while they are pregnant. But there are some people, sometimes, I don't know whether it's ignorance, there are some too that because of the addiction of the substance
that
already, they get pregnant and
that
still,
because you only do that when you are already in it.
That is the issue.
So if you're already in it and you now become pregnant, it becomes difficult to stop.
Very difficult.
Yeah.
And when that happens, unfortunately, you are also worrying the child that is coming into the system. So these environmental exposures too can predispose someone to develop attention deficit hyperactivity disorder. So we should know it is related to genetics, which can be within your family. It can be because of some difficulties or some abnormalities in your brain, or it can be because of certain things that we do within our environment that make someone to develop hyperactivity disorder. So AKB, these are some of the causes.
Okay, thanks so much. So those who drink and then smoke, if you the drink and you can just stop when you are pregnant. But if you get addicted, it becomes difficult for you to stop. But that is what it can cause your precious baby, because every baby is precious to the parents. So that is what it can do to your precious babies. So let's look at the treatments and then the other support options that you have or that is available for ADHD.
Okay, so this is the interesting part for me when normally it comes to presenting some of these conditions.
Okay.
Because it tends to carry some sense of hope that it is not just about the condition, but there are some form of support or some form of help that can be provided. And we should know that with these individuals that are experiencing attention deficit hyperactivity disorder, when you realize some of these symptoms in your child or in your brother, in any person, and you approach the person, you should let the person know that there are proven help that can be available for this individual. And currently we are blessed. I normally continue to see we have mental health professionals, different kinds within Central Hospital, West Hospital, TTH, and other peripheral facilities as well. Okay. So with the treatment, it comes in two forms. So either provision of medication and other behavioral modifications that we normally provide. So with medication, depending on your mental health professional, when they assess the situation, they realize that you might need some medication, they will do that for you. And normally medications are also prescribed when especially other mental health conditions also set in. Okay. So for instance, because attention deficit hyperactivity disorder comes with inattention, those individuals normally tend to fail in a lot of things that they are doing. So because of that, some people begin to experience something like a failure syndrome. They begin to associate themselves to failure, and because of they associating themselves to the sense of failure, you begin to become worried that why is that only me in life? I'm not able to concentrate and focus on things and finish things as I want it. So with that, people can develop issues of depression, issues of anxiety, issues of sleep disorders, and other things. So the medication comes in to help those individuals treat those mental health conditions that came with it. There's also medications that are being prescribed to help kind of help individual tame them a little bit. So with that one, when you meet your mental health professional, they will help you to explore the various options of medications that will be available for either your child, or if you're an adult, that will be available for you. And the other form of therapy that we provide mostly are related to psychotherapy, and we will talk about other out of psychotherapy techniques that we also provide. So for instance, we provide behavioral therapy because what the behavioral therapy normally focus on is to help the individual modify the behavior that they are in. You realize that inattention, when we talk about inattention, is a behavior that is being shown. We talk about hyperactivity, it's also a behavior that is being shown. You talk about being impulsive, it's a behavior that is being shown. So when you go and meet your mental health professional, they will look at your child's situation and see which method or which particular thing that will fit for them. So if it is the behavioral therapy that they have to give you, they will give you strategies on how to help them modify their behavior. Sometimes too, the mental health professional gives parental coaching. So for some people, their condition is something very new to them. They don't have any idea about how to handle it, how to help themselves through this issue. So what the mental health professional does is that they help you, the parent, to understand how you are going to deal with this particular child or this particular individual. And sometimes there are certain behaviors or certain ways that even if it's a parent, the parent responds to the child and the child continues to do certain things that they do. So when you go and see the therapist, they will tell you, for instance, if the child does this, you can do this for the child. When the child does it this way, you can focus on it this way and help the child. Okay. So for instance, a simple thing that normally we talk about is something that we call a reward. So in psychology, we also have reward and punishment.
Okay.
So reward, a simple method is that when the child shows a behavior that you think is something that you want the child to continue showing, you just find something. It may not be a toffee, but maybe it may be a toy.
Something the child likes.
Yes, something the child likes. So when the child does that good thing, you just give one to the child. When you continue that way, the child gets to a point where they realize that, my parents want me to be doing this. So because the more I do this, the more they are going to give me the toy. Yeah. So once they are around you, they are going to make sure that they do that so that you continue to give them the toys that they want. So that is a way that we also use to modify behavior. Okay. Sometimes too, there are school adjustments that can be talked about. So when we talk about school adjustment, I mentioned that some teachers may not have knowledge about it. So your therapist or your mental health professional may help you, sometimes even speak to teachers to see how best they can help the teachers also handle the child within the school premises. These days, a lot of our children spend most of their time within school.
Or they leave home like 7 and close like 5.
That is it.
Get home, they have to do homework.
Some people even do extra classes when they come back. When they come back to the house. So our children are really engaged these days, and
too much.
It's the truth is that we have to find time for them to play, and it's also a very important thing that we have to look out for. My Muslim brothers too, they also go to Makaranta on some of them
weekends.
Yes. I think now, because of some of the Arabic school, those who go there sometimes skip the weekends, Makaranta and other things. But those who don't go to the normal Arabic school, they will go to school from the weekdays,
Monday to Friday, and then
the weekends you go to Makaranta and other things. It's good that we are religious, but it's also equally good that we also let the children to find time to be able to connect with each other. That is how we are all able to develop. Some of us, it is the way we are used to playing outside and dirtying ourselves, and we will come to the house and they will cane us and other things, but we will still go. That has also helped modify us in a certain way. So sometimes it's also good to let the children have some free time for themselves,
have some
and not
fun.
Yes, only focus on that. So when there is a need to bring a teacher on board, your psychologist can talk to your teacher, or the mental health professional can engage the teacher and see within the school environment what can be done for the child in this particular instance. Then there's other form of counseling that might be provided if needed in that particular instance. So these are some of the ways that we can use to treat attention deficit disorder. And I just want to encourage people that with all that I'm talking about, when you see the professionals, these are proven ways that they can use to help your child. Just that I would urge that if you also come, just be patient a little bit, because sometimes some people are normally tired of the children in the house and other things. So when they come, they want quick kind of results.
Yeah, you have to have such a child at home, enough for more.
So sometimes people want quick results, but it doesn't work that way. It takes time. So when you come, let's also be a little patient, and also allow the mental health professional to start providing the strategies, and we will see how best things can also work in that regard. So AKV, that is it for the treatment.
We don't know what they go through. You don't know what they go through. All right, so thank you very much for the treatment, and then support options that are available for those with such conditions, especially children or those with such disorder. Now let's look at how families, our schools, because you mentioned teachers, and as we already said, the children, they even spend more time in school than at home. And if it's an adult, the workplace, and even our community in general, because you live in a community. How can all these people support someone with this disorder, the ADHD disorder?
Okay, thank you very much. So the first thing that I would like to talk about is that sometimes within our social setting, people judge quickly. People don't even observe to see what is the results of what is causing this behavior that this person is showing. So sometimes it's just important that before we judge someone, let's try to understand why, or what is the reason behind what is happening. Because before we begin to judge them and give them names and start calling people with some funny names and other things. So let's be cautious of that. Some simple ways that we can use is that, for instance, you can use praise. So praise more than attention, praise more than punishment. So you realize that the child is doing something that is right, try to praise the child more than punishing the child. You realize that even punishing that particular child, they still go back to do it. So if your punishment was working, the child might have stopped whatever that they are doing at that particular point in time. So you should rather praise more than punish the child. Also, you can give, if you are given an instruction, give one instruction at a time. Because with people with attention deficit hyperactivity disorder, it is like you've turned on 20 radio stations and they are playing at once in their head. Definitely, if you have those different kinds of sounds in your mind, you have difficulty concentrating on one. So if you want to give that particular child an instruction, give one instruction at a time. When they finish, then you give another thing. The same way, if you are also at the workplace and you realize that there's a lot of tasks for you to do, don't try to do all of them at the same time. Focus on one, finish it. When you finish one, then you can move on to the next one. Because of the nature of the condition, that is how you have to go about things. Then with people with attention deficit disorder, because of the difficulty with inattention, it is good that you also create a predictable routine, so that if they wake up, if it's a child, they wake up, they know that, oh, I have to go and brush. After that, I have to go and bath. After that, maybe I'll put my clothes on, then I'll prepare for school. Keep a predictable routine so that they know and understand, because for them it's like a lot of things that are going on in their head at the same time. Then you can also use reminders and visual schedules. So if it's an adult and it's a task for you to perform, you have a phone, you can set a reminder on it to remind you that there is something that you need to perform by this particular point in time. Then with children specifically, because we talk about they have difficulty sitting still, don't make up your mind that you are going to restrict entirely their movement. Allow them some movement breaks. Allow them to flex their muscles more at that particular point in time whilst watching them.
Muscles no making you flexing small.
Or flexing small. Managing table is so kakra.
On your table is so kakra.
On your table is so kakra. But watch the person. So allow them, because the person is already jittery. So confining the person at that particular point in time for a very long time, just allow the break for the person to release some stress and some tension so that they can recoup and come back to the activity or the task that you are giving them at hand. And also one key thing that we normally don't do as individuals is that a lot of us like focusing on people's negative, and we tend to forget about the strength. So with individuals with hyperactivity, attention deficit hyperactivity disorder, one thing that you realize is that even though the person has this difficulty that they are battling with, there might be some area that the person is very good at. So instead of always focusing on, oh, you are not able to sit still, when we tell you to put this here, you are not able to do it, you are not able to finish this, also try to also focus on the strength, and also give them, for instance, that if you realize that they are very good at maybe performing a particular task, most of the time try to give that particular task for them. Let them be able to finish it and they will feel okay about it. At least for some people too, it might be they are able to play a musical instrument, so they are very good at that. Try to praise them on that. So anytime that you want to get them to do a particular thing, you can bring that in. Oh, you normally do well in this, can we try it in this way? So that you are already praising the person, and that encouragement can also help the individual. So let's try to normally focus us on the strength and stop only focusing on the negative side, and also waiting that the person will make a mistake before you now correct them. So when they are also in the process and you realize that it's diverted, you can engage in the process and correct the person. Don't stay aloof and let everything go bad, and now you are coming in that you are now going to correct the person. At home, some of the things that we can do is that we try to help them to fix their homework time. So if it's a child, try to fix a time. We talk about predictability. Try to fix a time for homework so that they know that this particular time is for homework. So even if they roam a little bit and come back, they'll come and sit on the homework and write something, one thing, and maybe they can roam and come back again. So let's fix a particular time for that. You can also put, as I talk about schedule, you can chart various tasks that you are providing for the child when the child is at home, to be able to know that if I finish this, I'm going to this. Then we can also be calm when we are correcting those individuals. No one wants to be shouted at when we make a mistake and you are trying to correct us. So let's be calm and try to approach them in an instance where we are trying to correct them. And at school, one thing that we can do is that we can provide them extra time. Unfortunately, a lot of teachers don't have time these days, and it's because of sometimes to the size of the class. So for some people, some of our government school, you might even get 40, 50 students in the same class. So you can imagine if you are having this condition in the class, your teacher might not even bother to even help you. But the best thing is that if you can afford, and for instance, there's a child that is in school, try to get the child into a school where the teachers can at least have some form of attention for the child to be able to catch up, because they need that to be able to catch up. So in that instance, if the person is in school, or if the person is also an adult and is working as a boss, you can also try to give the person extra time in performing various tasks. So maybe if you are giving a deadline of 1 week for every individual, you can make theirs 2. So the simple analogy is that if you were supposed to give it to them today, maybe you can give theirs to them maybe last week.
Earlier, okay.
Yes, so you give it to them earlier so that they start doing theirs very quicker than the others. So you provide them extra time in tasks that they perform. Then we can also provide them with written instruction. That is when the person can read. So if it's an adult and the person can read, if we are having any instruction, sometimes some people are giving you work. The instructions are even more than the work itself that they are giving you. It's like sometimes you are confused. You are going to a place and you are confused, and you go and meet. Unfortunately for you, meet another confused person and you ask the person for direction. They will help you to even get lost more.
Confused.
So sometimes it's just better that we write the instructions down for the individual, so that the individual can follow and know that if I finish this one, I have to go to this. And even if they forget, they are not able to pay attention to whatever that you said, they can go by whatever that you provided them within your instructions. So AKB, these are some of the few things that we can talk about, and the strategies that we can use both in the house and at school or at the workplace that can help individuals with attention deficit hyperactivity disorder. If you still want more, Captain Amina and the other mental health professionals at West Hospital, DTH, and Central Hospital, they can help you with extra ones. So AKB, that is it.
Thank you very, very, very much, Barnabas. So Yakubu Hussein says, good morning, my humble good morning, my humble prof and his team. I'm really enjoying your presentation. Really enjoying your presentation today. God bless you all. Then Dauda Hamza says that just taking notes, Fila FM is doing great job. Yaya Tiborata says, I see you, great presentation, good job. So that has been Barnabas taking us through attention deficit hyperactivity disorder, and I believe that we really understand that disorder now. So in short, you just have to be patient with such people, right?
Yes.
You need to be very, very patient with them.
Yes.
That is how you can help them. And
it's a behavior that we modify, like we provide management.
Okay.
So it cannot be cured.
Okay.
Let me be specific. It cannot be cured.
You can only manage it.
We manage it, but it cannot be cured.
Okay. All right. So if you have a child like that, you should know, say, it can only be managed, but it cannot be cured. Just only but
the best thing is that the good thing is that for some people, their management is so good that they become perfect, and you don't tend to even see that they have that condition.
They have that condition.
It may surface in certain stressful situations, but some people, they're able to do well without you really seeing it, but it's not a curable condition.
Okay, it isn't a curable condition. So that is it. Talking about understanding attention that's attention deficit hyperactivity disorder. And I'm sure if you have one at home and you didn't know, you know by now that it is a disorder that you need to seek help or support for. If not, I'll bet it who say yes. All right, so that is how we end our mental health show this morning, talking about understanding attention deficit hyperactivity disorder. So if you have one, please learn to live with them and then also support them. And when you support them, you are supporting yourself. If you have such a child in school, as you support them, you are supporting yourself, because maybe you'll be able to keep the child calm and it will be to your benefit as well. All right, Barnabas, so let's take your final words and then we are out.
Okay, so what I would like to say is that we are always there. If you don't understand anything about whatever that your child might be experiencing, or a relative of yours might be experiencing, which is related to this condition, you can always come around, and we are always willing and happy to provide you with that help. And we should know that there is always hope for these conditions that we talk about. That is why we are trying to always educate individuals out there that if you have someone that is experiencing or that is witnessing some of these symptoms that we normally come to talk about, you can walk to our place and we will provide you the needed help that you require. I want to end here and say and thank our listeners for always being with us and being supportive throughout the period. And also a good morning to my in charge, Mama Yvonne, back at West Hospital. One of my seniors, Mr. Yakubu, is listening, so good morning to him as well. And Yaya Tiborata, she said it's a Wala thing.
Wala thing, yeah.
We don't feel the meaning of it, though.
Tiborata.
I say we should love each other or something.
Okay.
So a good morning to her as well. And I think was it Mashoud or Dramani that talked?
That's also a Fuseni. Yakubu Fuseni.
Okay, so that's my senior. So good morning to them.
And then Dauda Hamza.
Oh, okay. So good morning to them as well. And I also want to thank Phila FM for always giving us this opportunity to educate the people of Tamale and other areas at large. To be frank, I had some small engagement with some people, and I mentioned radio education about mental health, and the people are interested. So they are even telling me to send some videos for them to actually see. So this is a very interesting thing that people wanted to actually witness it in their setting, and they are not getting. So
that opportunity.
I'm happy that we have this opportunity to be providing people with Tamale with this education when it comes to mental health. I forgot to say good morning to my HR, so Mama Getty, good morning to you as well. So thank you very much, AKB, for the opportunity.
Okay. Thanks also to you so much for dedicating your time every Tuesday to come and then educate our listeners on mental health, especially to you, to Major Amina, and then Dr. Achu, and all the others who have been coming. We appreciate your time with us so much. And thanks to you out there also for doing the listening, for watching us live on Facebook and also on TikTok. I believe that you have learned something from our discussion today that will help you and also your family as well. So this is where we end the show on our mental health this morning. I've been talking to Barnabas, our Tangongo mental health officer or professional with the Tamale West Hospital Mental Health Unit. Thanks also to Combs and Matthew for the Facebook Live. My name is Akusia Kwatma Boache. You can call me AKB. Today the owner of AKB is not here, so my family. My family for some time now. My family. So quickly, we have to join the nation's capital for the discussion segment by kind Katsi DBS Industries.